Many elderly people want to remain in their home because that's what's familiar to them. There's many different ways that we can work with adapting their home to help them as they have needs. One of the best things to do is to find a home or adapt a home to where everything's on one level. So if you can have a bathroom on the main level, the washer and dryer on the main level, that's usually the best. It's even better if it's a zero-step entry or an attached garage with no steps. Oftentimes we're having to find family members or resources in order to build a ramp for people to get in and out of their home. Typically what we see with people that are coming straight out of the hospital is that they are weakened from whatever they were in the hospital for. And so oftentimes getting in and out of the house and going up and down stairs is hard for them. Sometimes that is the main factor on why they would need to go into a short stay or a nursing home. One of the other factors on staying in the home longer is, just adapting the home to make it easier to function. Some of those things might be putting a microwave on the countertop instead of up if they are maneuvering around in a wheelchair. It might be putting up handlebars in the bathroom for them to toilet themselves and get in and out of the shower or tub. It might be something like a shower bench or a tub chair that they can use. Instead of having a shower head, maybe having a handheld shower. One of the other things that we often look for when one of our physical therapists will go out and do an assessment in the home is fall issues. So some of the most common ones are uneven flooring, any scatter rugs that might be around, loose cords. Sometimes it's even just transitioning from linoleum type floor to a floor that has carpeting, especially if they have a walker and they're not used to a walker or a wheelchair. Maneuvering around on the carpet can be more difficult for them. So one of the benefits to staying at home is that the patient is already set up there. One of the things that patients or residents have the biggest issue with is moving into another place, leaving all of their friends, things that are familiar to them. And I think one of the biggest issues is downsizing and having to get rid of their things. Their things are very important to them, and that is something that's very difficult for them. It's like leaving a part of them behind. Another thing that we are really seeing a trend so far is a lack of nursing staff in the facilities. So if we can work with the patients or the residents in their home as long as possible and keep them there, work with the families, work with outside agencies, work with other technology or nursing services, the longer that we can keep them in their homes, it's better for everyone all around. Some of the risks for people to be at home too long, sometimes what we see is families coming home from a holiday and maybe mom was a little bit forgetful at the beginning of the summer, and now they come home at Christmas time and they see that the house is in shambles. Mom's not remembering to feed herself, mom's not taking very good care of herself. She's not able to maintain the home with the household day-to-day activities like making her bed, doing laundry, cleaning up after herself. Maybe it's that she's having difficulty getting out to the store to get food. That is when we really see it as an issue, and as social workers or healthcare staff, then we sometimes have to intervene. It's hard when people don't have family in the area or somebody to check in on them, and we just want to make sure that those people don't fall through the cracks. So some of the ways that we keep patients or residents in their homes longer is supplementing services. So if it's difficult for them to get out and get groceries or making sure that they're eating nutritious meals, we can implement Meals on Wheels. We can also get in chore services if needed. There are different programs through home health agencies like PCA workers that can come in and help in the homes. At LB Homes, we have the whole spectrum of care here, and so we do home care and hospice. And another thing that we've really been implementing is in-home technology. And that has been really great at keeping people in the home because we get a good picture of their day-to-day vitals and health statistics. This is one way that we can keep tabs on them and really see how their health is going. Are they doing okay? Do they seem to be getting shorter of breath? Are they perhaps fighting an illness or like a UTI or maybe pneumonia? If we see those things showing up on their vital signs, that gives us a clue to check in on them. Perhaps it's time to do a home visit. Perhaps it's time just to revisit their medications, looking at what their daily activities are. Another thing that we can implement in the homes, there are lots of different chore service facilities, people that work with medical equipment that can come in and look at the homes and make adaptations to the homes based on their suggestions. With home health, the nurses and the therapists, physical therapists and occupational therapists, can come in and do an assessment and make recommendations based on their findings. Of course, it's always up to the family and up to the patient as far as what they're comfortable with. Sometimes it's an issue of payment. They don't have the money available to make these renovations. We also have social workers that are available to help maneuver through those. There's a lot of different places out where you can apply for a grant to help to modify a home. And so we help them find different resources to be able to do that. So often people start out their journey